How can you identify various bladder infections? Imagine feeling a sudden urge to go to the bathroom again and again, even if you just went a little while ago. That's often one of the first signs of a bladder infection, also called cystitis. Since bladder infections are a type of urinary tract infection caused mainly by bacteria, recognizing the symptoms early can help you get the right treatment. Common signs include feeling a frequent and urgent need to urinate, but passing only small amounts of urine each time. You might also experience a burning or stinging sensation when you urinate, which is called dysuria. Sometimes, you feel like you need to go even when your bladder is empty, and there can be discomfort or pressure just above the pubic bone. Your urine might look cloudy, have a strong smell, or contain blood, which appears as red or pink in the urine. In rare cases, especially if there is an abnormal connection between the bladder and other organs, air bubbles might be present in the urine. Older adults may not show typical symptoms. Instead, they might have mild signs like fever, confusion, or changes in behavior. Children can have similar symptoms but may also show fever, irritability, poor feeding, vomiting, or bedwetting even after they are toilet trained. To confirm a bladder infection, healthcare providers usually start with a detailed medical history and a physical exam, including checking for tenderness just above the pubic area. The next step involves laboratory tests on a urine sample. A urinalysis can detect white blood cells, red blood cells, and bacteria, all signs of infection. A urine culture helps identify the specific bacteria causing the infection and guides the choice of antibiotics. In cases where infections keep coming back or if there are complications, additional tests like imaging of the urinary tract or a cystoscopy, which involves looking inside the bladder with a small camera, may be recommended to check for underlying issues like kidney stones or structural abnormalities. It is important to distinguish bladder infections from other urinary problems and more serious infections like kidney infections, which often cause fever, chills, nausea, vomiting, or pain in the back or sides. Recognizing the signs early and consulting a healthcare professional can lead to effective treatment, help prevent complications, and support overall bladder health. If you notice symptoms that suggest a bladder infection, seeking medical advice is the best way to get a proper diagnosis and treatment plan tailored to your needs. Remember, each person's experience can be different, so personalized medical care is always important.